people here. So as I said, thank you so much for joining us for this discussion about why scientists should work with the media. I'm absolutely delighted that we're being joined this evening by Freya Robb from the Science Media Centre, based down in London. I first came across the Science Media Centre in a former life in my former role before I joined Brain Health Scotland. I was a journalist and then a press officer at the University of Edinburgh. So I suppose I've worked on both sides of the kind of media kind of issue there, in terms of trying to find stories and interviews, and also trying to push them out through the national press. And that my work with the Science Media Centre genuinely was the highlight of my time as a press officer, certainly. Freya is going to explain to us a lot more about what the Science Media Centre does and why they exist, but essentially their purpose is to ensure that the UK press have access to the best, highest quality science expertise, so that they can cover sensitive issues and scientific issues in a really responsible and credible manner. And that is just a huge service, I feel, to UK audiences, to the kind of readership of newspapers, and to the audiences of broadcast media as well. I'm sure Freya is going to touch on the kind of origins of them, but I think if you can think of some of the, I'm sure we can all remember issues like MMR, or Frankenstein food headlines that you can think of the past, when UK journalists just either didn't have access or weren't easily facilitated to get access to scientific experts who could kind of correct misinformation or kind of negative scare stories. And now I really feel that the Science Media Centre has built up relationships with all of the kind of the best, highest quality kind of journalists in the country, to ensure that they do have that access now, and that they can sorry, I'll just admit somebody here, so that they can cover these issues and know that they've got the very best information to pass on to their audiences. So really looking forward to this session. I'm going to hand over to Freya now, and then we will have a Q&A afterwards, where we can kind of discuss the issues that are raised in her presentation. So thank you so much, Freya.
Great, thanks Anna, and thanks for having me. I've got some slides, so I'll just share my screen now, and hopefully that will work. Okay, so I can't see anyone, but I think that's all okay, so shout if not. But so yeah, I'm going to talk a little bit about the history and background of the Science Media Centre, and then also give some examples, hopefully sort of highlighting how we work and the impact that we can hopefully have on the UK mainstream media. I'm one of the press officers at the Science Media Centre, one of 5, and so just a bit of background to start off with. We are an independent press office for science. Our aim is to improve the accuracy of reporting, not the amount, not that we need any more science in the news at the moment. And also we really focus on the messy and controversial topics, breaking news and scare stories. So we wouldn't work on every science story. We really focus on issues where we think it's really vitally important that the science is reported accurately, because of the impact it can have on people's behaviours and decision making, and just sort of their understanding of lots of important sort of like health issues as well. Our philosophy is that we'll get the media to do science better when scientists do the media better. So we're really sort of media led and media driven, and often it's about trying to support academics and scientists to work to the slightly frantic deadlines that the media does, and just to get their voices out there in a way that works and has impact. Just a couple of background slides now, just to sort of highlight why we think it's still so important to work with sort of quite traditional news sources and news media. People still go to the news, especially online still, even though there's a lot of discussion that sort of social media is taking off, and it absolutely is, there is still a huge sort of precedence for getting accurate science coverage in the more traditional mainstream news, even if that is the online version of sort of the Daily Mail or the Guardian or the BBC, and broadcast media as well. That is where most people tend to still get a lot of their news and information about science and health stories. So if that is inaccurate, that is a huge issue, and so that's why we really focus our efforts on those outlets. And again, just another sort of more general background slide. It's a little bit blurry actually, but hopefully you can see that at the top you've got nurses, doctors, engineers, teachers, judges, professors and scientists, and these are when members of the public are asked, if I tell you the name of a profession, would you generally trust them to tell you the truth or not? And this is a really privileged position for researchers to be in. It's not a given. I think researchers really need to contribute to continuing this trustworthy, this trust that the public has in them by demonstrating openness and trustworthiness and really engaging with the public when they want to hear from you. And just sort of on the flip side, you've got government ministers, politicians and journalists much, much lower, right down the bottom. And so actually your responsibility and sort of impact in helping the public understand it, they really do want to hear from you and they trust what you're saying to them as well. So I think that's a really privileged position to be in and something that I don't think we should lose. And part of maintaining that, I think, is continuing to engage with the media and reach the public through that means. So very briefly, the SMC database is made up of lots and lots of scientists from across academia and industry in a huge variety of scientific fields. We do tend to try and recruit experts in areas of science that often make the news media, and dementia is obviously a huge part of that. So we're always on the lookout for more researchers in this field to try and help us get across all areas of dementia research so we can quickly find experts for journalists to chat to or help with their coverage as and when they need it. We also have over 1,000 press officers from all of the same organisations that we have experts from. We can't be completely across everything, so we're really we do need the support from like these other press officers that know their academics really well, can help us get in contact with the right person, find the right people, highlight new studies to us and sort of help with that whole process. And the final part of that sort of jigsaw is the journalists, of course. We work with the science, health and environment correspondents from all of the major UK national news outlets. So just very briefly, we are quite UK focused. That has changed in the last year where we've got many more global journalists on our list, but that is mainly down to COVID. And we're still waiting to see if that will continue post-pandemic. But essentially, we work with the newswires, which are in the middle, and they write very quick, accurate, sort of straight copy very, very quickly. And often that gets sent to all of the other outlets and papers. So they're a really key part of the sort of group of people we work with. And we also work with sort of broadcast, the broadsheets and the tabloids as well. So basically any of the national news outlets in the UK we will work with very closely. And it's worth pointing out that this isn't true globally, but every outlet tends to have specialist journalists, and we would always encourage working with the specialist science and health journalists when you do media work. They have often been on the beat for a long time. They really know their stuff. They are aware of previous studies in the field in that area, so they can ask really good questions. And on the whole, they're just a really, really great bunch of journalists. So really worth sort of seeking them out if you are planning on doing media work. Very quickly, just a slide of our funders. We are a charity and we are funded by multiple sort of organisations across the scientific and health sort of fields, including some media funders as well, but mainly lots of universities, Royal Institutes, Royal Academies and things like that. No one can give over 5% of our annual income to try and just sort of demonstrate transparency and that we're not sort of influenced by any of our funders. The exceptions to that are UKRI and the Wellcome Trust, where we're housed, who fund a slightly higher percentage of that. We don't do anything in return for funding. This is a bit of a tricky sort of pitch, and luckily I don't have to do it, but we basically say if the scientific community thinks what we're doing is useful, we would love that we sort of have a donation from them. If a scientist from an organisation that doesn't fund us comes and seeks help from us, we will work with them, whether their organisation funds us or not. And equally, if a funder comes to us with a story, we're not just going to say yes to working on that story because they're a funder. We'll evaluate every single story as and when sort of it comes through, depending on whether we think it needs to be worked on by the SMC. So next up is the second part of my talk. I'm just going to go through some examples of sort of the main things that we do day to day, hopefully highlighting how you can get involved and how you can do media work. This is very specific to the SMC, but a lot of the principles apply just generally doing media work with your press office or with the journal when you've got a journal paper coming out. So the one at the bottom, journalist inquiries, very straightforward. A journalist can come to us with any question at any time, and we will try and find them the right sort of expert to speak to. Is rapid reactions. So this is for big breaking news stories. We really, really believe that science in the headlines is an opportunity as well as a threat. There are some subjects that very, very rarely reach the media. And sorry, I think I've got an ice cream van going past me. I hope that's not too distracting. So science in the headlines is an opportunity as well as a threat. So lots of subjects that rarely make headlines will suddenly become the big story of the day. And I think that's especially true if you think of COVID. I don't think anyone cared how well diagnostic test sensitivity worked until a few months ago. So like, it's really a good opportunity to get your science out there. It's when journalists want to hear from you. It's when you're going to have a platform to speak about your research and your area of expertise. So it's a really good opportunity to get into the media when these big breaking stories are happening. It's an opportunity to convey the best science and evidence when the public are most engaged with it or very concerned. It might be quite a scary story and they're really looking for good quality evidence to help either reassure them or help them evaluate whatever risk they think they might be exposed to. And it just ensures that the very best science is part of the media narrative from the beginning. It's much easier to influence the narrative from the start of a story rather than correct it once it's gone awry or off course or through whatever sort of non-evidence-based situation it's gone down. It's really useful if you can be in there right at the start of the story and help influence it from the very beginning. This is the quickest we work. We will be monitoring the news, and if there's a breaking story that we think science or scientific expertise can help inform, we will probably be asking you for comments within sort of the next half hour if possible, and it might be on quite a rolling basis. These are just some of the types of stories that we do a lot of rapid reactions on, and as you can see, it's quite scary, happen quite quickly. Often it's a subject where lots of reporters have probably never really covered anything of that sort, so they're really after a lot of information very quickly, and they probably don't have a lot of background knowledge in the area, so it's so useful to have rapid sort of access to expertise on these kinds of issues. I would say, I'm going to give an example now. I didn't have an example on dementia when we look back through our archives, and I think that might partly be because I'm not sure things sort of happen in sort of a shocking way and sort of suddenly breaking news, and a lot of it tends to come through sort of capers and things. But I'm going to show you this example from COVID, and I think it might be applicable for things that might be coming up in the future around more sort of dementia relevant topics and stories. So this was an example from a couple months ago. So 7th of April was after about a month of rising concerns about this low platelet count and rare blood clots that we were seeing after the Oxford AstraZeneca vaccine. So sort of globally, there was increasing concern, very small number of cases, but getting more and more certain about it. So both the EMA and MHRA and JCVI did sort of statements at the same time one afternoon saying there is pretty strong evidence of a possible link between them. And JCVI in the UK also recommended that those under 30 should get a different vaccine if possible. So this was really big news at the time, and it was really important that alongside these sort of official statements, we try to get good quality comments from across the sort of scientific community, helping explain the situation and what it meant. No one's really, I don't know, in the public sphere followed this kind of event as closely as it has been with COVID and sort of the follow-up of sort of vaccine safety regulation and monitoring and pharmacovigilance. So we gathered these comments as quickly as possible in response to the statements. I'm not going to ask you to read all of these, but just sort of what these comments were doing with explaining the situation, actually saying this is exactly what good pharmacovigilance is doing, putting it into perspective of the risks compared to the risks of COVID, explaining why certain age groups it might not be the best vaccine to take, but that also depended on lots of other factors, and that's why different countries were also doing different things. And again, sort of, even though the official statements were very clear as well, and there was a lot of good communication around that, getting people that were very closely involved in sort of more of the research side of things as well to help comment on what they were finding and explaining what they thought about the statements that have just come out. So this was the front pages the next day. And obviously, I'm not saying the roundup caused these front pages. This was going to be the big story no matter what. And that's what happens with rapid reactions. You're not generating the story, you're helping inform it. And so I think we had about 25 pieces of coverage within the body of coverage where we got these quotes into the papers and in the press. And lots of them were sort of Q&A type things. What should I be worried about? What does this mean? Should I get the vaccine if I've already had my first dose? Lots of these questions and things were being written about in these Q&A type pieces, and we were getting lots and lots of pickup of the comments and quotes, helping inform the public as to what they should know about the situation, and also if they have been vaccinated to be aware of what this rare condition was as well. And again, just a couple more examples. So it was really useful just to add to the rest of the context. There was good communication from the agencies as well, but help explain what was going on to the public, because it was quite a scary story at the time. These blood clots sound awful. There was a lot of discussion and differences among countries, so it was really important that we try to explain it as clearly as possible. I would just say, I think a possible example in the dementia field is the upcoming FDA announcement on this e-drug. I'm going to completely mispronounce it. I've actually written it down, so I try and say it properly. Aducanumab. And so I've been following that story for a bit, and that's the kind of thing that we might do a rapid reaction on in dementia. Whatever gets announced, we will go to our database of experts and we might say, right, this is what's been said. Can you comment on what you think of the quality of evidence behind this? Do you think this is a good decision? What are the implications? What happens next? Do people all of a sudden get treated with this drug? What does this drug seem to do? What are the uncertainties that remain? So answering all those questions in response to a breaking news story, that was sort of what I thought might be something that comes up more in sort of dementia research in terms of rapid breaking news. Secondly is roundups, and this is the majority of what we do. So it's about putting research into context. So we receive press releases from the top journals, universities and funders. We're getting more and more preprints, but I'm hoping that is a very COVID specific thing, because that really messes up the sort of the time scale in which we're working. So we get the press releases at the same time as the journalists do, and we run through them each morning and we say, right, this one we think the journalists are going to be really interested in, but on top of that, can the SMC add value? And that added value will be seeking third-party expert comments to provide context and guide journalists in their reporting. Could it be misreported or sensationalized, and are there aspects which we can go to our database and say, can you highlight what you think of the study? What are the strengths of the study? What are the limitations? What's the sample size? Was it done in cells? Was it done in mice? Was it done in humans? Is it a phase 3 trial? Are there any limitations that really affect how this can be interpreted? And what does it mean for either sort of sufferers of a disease or your behavioural sort of how you decide to behave? Is there anything significant that you can say about this that will guide people into sort of changing their behaviours? And if not, what are the limitations, and why shouldn't we take this at sort of face value? So this is just to sort of highlight where we fit in. A bit simplistic, sorry if this is too simple, but yeah, so we sort of fit in while the press release is out under embargo with the journalists, and so we're trying to work proactively before the story hits the sort of the public sphere and helping inform that coverage as and when it comes out. So one example of this is a press release on a nutritional compound and Alzheimer's disease. So this is a press release. So it was under embargo, and it says, study suggests nutritional compounds can delay Alzheimer's disease. The journalists were obviously really interested in this, and it was flagged up to us multiple times by multiple journalists, and we knew we were going to sort of work on this. And the bit at the bottom is one of the quotes from the press release. This represents one of the most important medical advancements of the century and paves the way for potential prevention of Alzheimer's disease. So yes, extraordinary claims need extraordinary evidence. The journalists were after that. So we sent the paper and this press release to the relevant experts, and we gathered some comments. So as you can see, these are not the most flattering comments of this research. Basically saying it's really impossible to tell much about this work and what it concludes. It's not set up to answer the question that it's saying it does. We also went to some sort of professor of metabolic medicine and said, oh, there's no reliance on these results. Again, not enough people to answer the question. So we sent these out under embargo to all of the journalists on our lists. And I'm not going to say it stopped the story completely, but if you look where it's highlighted, the roundups had a real impact on this piece of coverage. I'd also say that there wasn't a lot of coverage. There was potential for this to be a very big, high-profile story, and it just wasn't that. It was a bit of a damp squib, but they did write about it. But as you can see in the stand first, it said experts claim the study is too small and the results highly unlikely to be true. And there's also a lot of commentary as well. Secondly, this was some more coverage, and as you can see, the roundup actually led the coverage in a way. So Alzheimer's supplement breakthrough condemned by experts. And so I think that was a really nice demonstration of just the impact that you can have by speaking to the media. It shows that they are actually very interested in hearing what you have to say. We do know that some journalists manage to squash the story. A lot of the time, a news editor might say, oh, this looks exciting, can you write it? And then the science journalist can use backup and say, actually, loads of these experts are really condemning the research. I don't think we should write about it. So a lot of what good science journalists do is keep stuff out of the press at all. And then one step further, they might actually condemn sort of bad practice in terms of overhyping research. Lastly, I'm going to go through some media briefings. These are really fun and engaging and a great way to get to meet journalists more and more. It's also a great opportunity to sort of set the agenda. So you are setting up the story, you are making introductory comments, and you have more control of the way the story comes out because you've got a bit of time to think about how you want to present your findings. It might be a new research paper, or it might be a more general background briefing on a particular area of dementia research. And it just gives you a bit of extra time to explain complex science in more detail than a simple press release would do. And it is just a really great way of scientists and journalists meeting, at least now it's virtually, but describing the process of science and really helping get, so the journalists can really ask all the questions and get their heads around it before they go off and write about the research. So they're really useful. And so I've got a couple of examples of them. So this was a news briefing, so on a new piece of work, and it was a new study on lifestyle and genetic risk factors. So we thought that was really important to have a bit more depth and detail involved in the reporting, because these are things that people can change. Sort of, it's, even though we equally think it's important when there's sort of new drugs that we don't create false hope or generate false hope, when it's a story where actually the readers can change something quite significant about their lives in response to what they've read, we think it's really important that it's written about accurately. So we brought in two of the authors to come and discuss the work, and there was lots of really long, I've not included sort of the full text, but really long detailed articles helping explain the research as well as the limitations of the work as well. Secondly, this is a background briefing, so this wasn't about results per se, but it was about an area of dementia research that we thought maybe doesn't get enough traction. A lot of it's what do you eat, exercising, potential drugs that don't actually work that are being touted as working. And so this was an opportunity to talk more generally about new research coming out, and that there was a new targeted focus on people already living with dementia who new drug treatments aren't really going to impact, but it's a really important area that we think was worth the science and health journalists hearing about. And so even though there weren't results, it got a really big turnout, and it's really nice to sort of get the journalists asking questions about how they're going to research these things, what ideas they have, and sort of how they're going to navigate and work out what new technology might actually really help and support people living with dementia. So there was some really nice coverage of that as well, and just a chance for researchers, because a lot of this research is publicly funded, so it's really important that the public hear about what you guys are doing with their money and sort of helping explain how the scientific process works, how you're going to test these things, and how it might hopefully impact them in the future. I'm very, very quickly going to just cover a little bit about something we can help with post the story going up or online or in print. And so I would always say the best approach is to do things proactively before it hits the news. Think about it in advance. If you do have a paper coming out you're worried about, chat to the SMC or your press office. But sometimes things come out, we'd missed this press release, we hadn't received it. So we saw the story the next day. And this top one is the first headline we saw in the sort of first look of coverage in the morning. And we sent it to a few experts and we said, we found the paper, we didn't work on it, what do you think? And one of our statisticians just got back and said, this study can't show anything of the sort. It's very limited, it's very small, it's observational. I think it's very causal the way it's been written up. So we got a comment sent from our statistician to the journalist and just said, hi, sorry, we're a bit late. I know you've already written it, but we've just had some comments through from the scientist and we thought you might be interested in reading them. And so they read them. And this bottom headline is what the study became in the updated version, the article became in the updated version. So it's much less definitive, and also this first bit was added. So definitive link cannot be drawn. And these are just little clips from the article itself. They used so many comments from Kevin, they added it in because there weren't actually any third-party comments to start off with. And again, it just goes into an analysis of what the paper is able to say and isn't able to say. And then again, sort of going through relative and absolute risks and really helping to put this into context as well. So the article went from quite causal, a little bit sort of, I don't know, not overhyped as such, but just quite strong in its wording that this was linked to this. And it became a much more nuanced article with much more sort of reflection on strengths and limitations of the study, and also really informative in terms of people reading about it, thinking about their rasher of bacon a day, and just what that means for them, even if this was found out to be sort of a direct causal link, and putting that into context. So finally, I'm going to wrap up and just say what I think is really useful and important when you are engaging with the media, and hopefully by the SMC as well. Honesty, so no party lines, speak to the evidence, change your position if the evidence changes, and admit uncertainties. Basically, be a scientist. Lots of people can make comments about research papers, and as we've seen with COVID, everyone has an opinion of everything. But as a research scientist, you have this amazing ability to really dig down into the study and say, does the study actually show this or not? So that's what journalists really want from you. You can say the study actually isn't able to show this in a way that lots of other sort of media commentators aren't able to do. A willingness. You have to be really willing to engage with the media. It's not always clean sailing. There are risks involved. You may possibly be misquoted. Rarely, or time to time, you really need to be able to sort of not drop everything. Everyone appreciates you're very sort of busy and everyone's got different timescales and stuff, but to work with the media, you do have to have an aspect of being willing at quite short notice to sort of jump on a call when you've got a few minutes free, or write a quick comment for a roundup. And I think you need to have that sort of willingness to make this story your business, champion your subject, and just be ready to help the media as and when they come to you. And we can be sort of the vehicle between that. And we absolutely don't say you have to reply to every email you get from us, because there are quite a lot. Just store them away in a folder, and if you've got a few minutes spare, you can look through them and just see which ones take your fancy and get back to us. Patience. A lot of the time it's repeating the same message. There's a lot of sort of very similar messages that come out in lots of roundups we do on dementia, but if they're important messages, they need to get across, and you might have to say them time and time again until you're blue in the face, but that's still worth doing and still important. And finally, resilience. I really do think the evidence usually wins out in the long run, and so it is really important that you keep engaging, even if your first experience isn't the best, or you've had a couple of dodgy experiences. If you have had that, get in touch with us, and we can either resolve it. A lot of the time, it's not any maliciousness from the journalist, it might just be a misunderstanding. So if you keep doing it, it's definitely worthwhile, and I do think the end result will be much better public understanding of your area of research. So finally, I just want to say, yeah, please do think about joining the SMC database if you're not already on it. If you are already on it, looking forward to working with you more, hopefully, after this talk, if you've not been convinced of it yet. And I've just got my contact details, which I can also share later as well, if you do have any later follow-up questions, or you would like to get in touch about joining the database as well. So that's the end of my talk, so I'll stop.